Good afternoon, my name is Leslie Medellin. Today I will be talking about women's health. The special interest group I have chosen for that would be osteoporosis, and the scenario I have chosen is scenario number 2. Now, women's health, just to elaborate on what it is the treatment and diagnosis of conditions and diseases that affect a woman's health, not only emotionally, but physically. Things that do this. So causes of this or other interest groups that you can go ahead and study for this would be cervical cancer, breast cancer, bone density, menopause, pregnancy, and osteoporosis, as so many others that there is in this section. Now, in my case, I have chosen osteoporosis. Essentially, what that is the loss of bone. This can occur because either too much bone is getting produced or too little bone is getting produced. In so many cases, there are other factors. One of the main factors would be that there is a lack of calcium in the body that does not let the bone form as it would. So the bone, rather than forming like a normal looking honeycomb bone under the microscopic view, it is kind of distorted and looks and gives people problems. So essentially, for this case, it would be women. Now, the scenario I have chosen is scenario number 2, which is a patient who is in a wheelchair is frustrated with her that there are no handicap designated parking spaces nor curbs cuts available outside the physical therapy clinic she attends, and is forced to park away from the entrance to perform a wheelie to go up and down the entrance. Now, for this, after extensive research, there is actually no law that would prohibit or close down or hold accountable a building or a business, or in this case, a physical therapy clinic, accountable for that reason of not having a handicap parking spot. Now, looking at our 10 professional behaviors, this is where that comes in handy, because seeing as you are taking care of these patients, you would essentially, not only would you be critical thinking for the patient that you are about to treat, you're also committed to learning and problem solving, because just thinking about this patient, so if we look at it into the critical thinking point of view, you have to think that she needs a way to get up there. For example, if she's just going there by herself, how would she, this can actually in a way affect whatever she is getting treated on, because she is forced to do a wheelie. There is consequences that can be faced, so she could get hurt. There is she could have a hard time. As it is, she already does have a hard time going up and down, and just transportation wise, committed to learning. So by learning, you would think that maybe getting that parking spot would help her have easier transportation, just kind of give her less of a harder time than she already is having because of the physical therapy that she is receiving. And problem solving, that just in itself explains it. You would be solving a problem that she has. She would no longer have to do wheelies or have a hard time going up to receive her treatment, because that's essentially what she is going to. I mean, someone that doesn't necessarily hold accountable, but does and try to enforce these things, would be the ADA, which that's the American Disability Act, and that's actually in title number 3, where they speak about having these certain accessibilities for people who have disabilities or are going through some things with their body and can't necessarily function as well as a normal human being.